Tens of thousands of children lost their Medicaid benefits. Working disabled adults lost Medicaid benefits. And how tragic is that? You know, you look at people who are working and benefiting society, and yet they clearly need some assistance with preventative care. Now people are relegated to emergency care, and I'm really troubled that I paid my taxes for a purpose, that these services would be provided. The dollars were not given. We returned almost $400 million matching federal dollars, which were returned to a pool that went to states that are giving more health care to their people. So we've lost those dollars. Somebody has to cover that cost, so insurance companies have to absorb it. Well, nobody's premiums are being lowered. They're going higher, and that just contributes to the escalating cost of health care in Missouri. So we've effectively paid twice. We've paid our taxes, now we'll pay higher insurance premiums, and ultimately people are still in dire need. And we're touting surplus dollars on the state level in terms of our budget. Those dollars could have been used to help keep people on Medicaid and allow many of them to still retain their benefits. So I don't see that as a winning combination or fiscally responsible. I think that we have to look at the surplus that we have now, and we have to look at what we could reinstate to make sure that we are being fiscally conservative and responsible. I think in addition, we need to remember that the more that we are building our revenue and bringing those dollars in, then we don't have to look at options like taxing people. We need to build up the economy. We need to make sure that these things are available. We can also work with corporations to find other ways that are maybe unique, such as if someone's doing some service in the community or coming up with a program to help with prescription drugs, what can we do to lower the real causes of escalating health care in Missouri? It's long-term health care. It's prescription drugs. Can we collectively buy prescriptions? What are the different options that we have? I say we need to look at all those and then make some very sound decisions on what would be the best for long-term solutions, not a short-term gain so it appears we addressed a problem. And I just know that we can do a better job than we have been doing. And one of the greatest problems I see is that we haven't engaged people enough. We haven't talked to the people in our community. You know, I knock door to door. I find that they're enraged by these cuts, and I think, where was the representation? Because had they really understood, they would not have supported this. So why aren't we having those conversations before we're taking these drastic steps that just devastate people's lives?